The Health of the Healing by Tabitha Harris. Nursing makes up one of the largest portions of the workforce in the medical field. They have many obligations and responsibilities such as performing physical exams, administering medications, wound care, and other health interventions. They are generally the primary provider in many settings. They are in high demand in many different settings such as hospitals, nursing homes, community health centers, and shelters. With nurses being in high demand and having a diverse range of skills, it is not uncommon for them to experience mental and physical health issues caused from their occupations. The problem is that nurses are experiencing mental and physical health issues such as depression, obesity, sleep deprivation, anxiety, and PTSD. More than 90% of nurses rated their stress levels at work in the moderate to very high range, with a higher level of stress in full-time nurses. There has been much speculation on what causes nurses to have health problems relating to their roles. They are having more burnouts and nurses are leaving the medical field. About 18% of new nurses leave their first job within 1 year of starting. Nursing shortages are happening worldwide. One state attempted a solution to the dilemma nurses are facing. Reforming the nurse-to-patient ratio has shown promise as a solution to reducing nurses' workloads in one state. California was the first and only state to create a mandatory nurse-to-patient ratio. Their regulations state that depending on the type of care, a nurse will have a specific number of patients. For example, nurses in the intensive care unit will have 2 patients and nurses in the surgical unit will have 6 patients. Since adopting this regulation on nursing workloads, nursing burnouts and job dissatisfaction was lowered. With nurses' workloads lowered, nurses are having less burnouts caused by mental and physical exhaustion. The nurse-to-patient ratio also led to nurse retention, which decreased the turnover and nursing shortages. The proposed proposition is creating a change in the nurses' workload. There is not a shortage of individuals with nursing qualifications. It is a shortage of nurses willing to work in the present conditions. An adjustment that needs to be made for nurses to have less health concerns is creating a mandatory nationwide nurse-to-patient ratio to aid with nurses' health concerns. There are positive effects to putting the proposition in motion, such as creating a ratio can alleviate some of the workload on nurses, causing a negative impact on their mental and physical health. Putting in place a reformed nurse-to-patient ratio will also likely cause less turnover in facilities and make it easier for facilities to retain nurses. More nurses retained will lead to less workloads and better health overall. This will also lead to better care for patients. With nurses having less patients, they will have more time to focus on the individuals. Creating the ratio will also lead to less medical errors, since nurses are not rushing and they are able to take more time with the task at hand. Mortality rates, bed sores, falls, and accidents will also decrease. Funding for making a ratio could come from different areas, such as advocacy groups like the American Nurses Association and American Association of Occupational Health Nurses, government programs, support from private entities such as companies like the Bank of America, fundraisers, and donations. Reforming the nurse-to-patient ratio could alleviate the nurses' workload. Currently, states that do not have the regulations on the ratio report having nurses that have heavier, more demanding workloads. California is the only state to have regulations on nurse-to-patient ratios currently. Since they have made this law, they have seen positive outcomes for nurses in their state. This suggests that creating a nationwide regulation could benefit all nurses' health across the country. The nursing field is in need of a change for better health outcomes for nurses. A nurse-to-patient ratio could be the change that nurses desperately need for their mental and physical well-being. Thank you.